How old are you?
55.
My client is a 55-year-old male, retired firefighter who's very active, and he had a knee scope 2 months ago and is getting regular physical therapy for that. He walks with a splint because his knee gives out easily. Can you elaborate on that behavior of the knee?
I had MCL repair done, as part of the scope, and it just felt like it never tightened back up. And then the muscles never seemed like they were doing their job supporting the knee either. And then here a couple weeks ago, a large German Shepherd hit me from the side and kind of re-sprained that MCL, and has created like some swelling and soreness and instability back in the knee again.
And what happens when you walk?
It feels like my knee's kind of collapsing inward, and I have pain on kind of the medial side of my knee.
Okay.
And it gets sore and it starts to swell.
Okay. And physical therapy has not been successful in freeing up this patella.
No.
And you've been working on it a lot yourself.
Yes.
Okay. So when I try and move the patella medially and laterally, I get the slightest amount of movement, extremely slight. When I squeeze and try and lift it, the retinacula is so very tight I can't get an upward movement. And I can't get inferior movement of it, nor superior. The right patella has quite free mobility. And I can squeeze it and it lifts forward slightly. I can glide it inferiorly and superiorly. Okay. You have good spring mobility in the distal femur. Okay. The left femur is more forward. The left thigh is more forward than the right. And when I slide my hand under, it stops. Okay, can you feel where I hit the back of the knee and I can't go any further? Let's test the left side. I go much further. Do you feel that?
Oh yeah.
I go all the way. I go all the way through. Now when I spring the mid femur on the right, there's spring mobility, and when I spring the left, there's no mobility. And the reason that this does not spring is because your hip is maintained in slight flexion. If you lie on your stomach, I will demonstrate hip extension on the right. That's an easy 20 degrees. This one, I can't lift it up. There's no hip extension on the left. And so I'm going to restore hip extension on this left side, and then I'll demonstrate how that will free up the patella. And maybe it'll reduce some of the quadricep inhibition. Go ahead and sit up and we'll show that inhibition. All right, straighten out this right leg. Do not let me bend it. 1, 2, 3, go. Good. Straighten out this one. On the count of 3, do not let me bend it. 1, 2, 3, go. Boom, it's just so easy to break it.
There's nothing there.
Yeah, so I think this is a neurological inhibition, and I think that when we restore hip extension, it's going to be a lot freer. So we'll film that after we treat you. Let's have you lay on your back. And the method that I use to restore hip extension is so very, very simple. And it's very easy for you to treat yourself. And I use this 2" by 4" by 8" foam wedge. Now we buy these, we sell them on online. You can also get them from Foam America, like Foam America.
Oh, okay. Yeah.
So I place this under the thigh, right below the sit bone. Okay? And that gaps the joint anteriorly, engages muscle, tendon, ligament, and reflexively relaxes the hip flexors. And you lay on that for 5 minutes. So I'm going to stop filming now. I'll have you lay on this for 5 minutes. We'll come back and we'll film the response.